Ladies and gentlemen, here it is. The most listened to radio show on the planet. Even the other stations are tuned in too.
You're listening to Business Talk Radio, where we take business to the next level.
Hello, everybody, and welcome back to the show here on a rainy day in New York. I am your host, Joey Sips, with Business Talk Radio, and I'm excited about our next guest here because I had the pleasure of hosting her last week. So if you have been tuning in at 11 a.m. Eastern Time, then you know exactly who I'm talking about. And she's a doctor, everybody. I love our doctors out there, like I always tell you. And this one specifically because she's a doctor, but she's got her own spin on things of what she does and how she does it. And that's what we're going to be talking about today. Her practice is located in Green Bay, Wisconsin, and she is the owner of Discovery Health Healing Center. It is my pleasure to welcome back to the show Dr. Kelly Felmer. Hey, Dr. Kelly, welcome back.
Thank you. I'm glad to be here.
Absolutely, and we are glad that you're here. And like I said, we had such a great show last week. We were talking a little, COVID-19. We were talking about your business. We were focusing on individual health. And at the end of our show last week, which is why I'm so excited about this week, is that we kind of touched upon IV nutrition therapy. And right there, a lot of people probably just opened their eyes like, what is that? Well, we're going to learn all about it today because you're going to tell us about it, and I'm really excited to learn about it as well. But before we dive into our topic, everybody, I always love to do a little overview of Dr. Kelly Felmer and what she does exactly at the Discovery Health Healing Center. And then we're going to dive into that main topic, which is IV nutrition therapy. And don't forget, the phone lines are open. Give us a call while we're live if you have any questions for Dr. Kelly. I'm sure that she'll have an answer for you. We'd love to hear from you. That number at the studio is 631-569-4576. That's 631-569-4576. And with that being said, let's do a minute or two overview, Dr. Kelly Felmer, about what you do exactly at the Discovery Health Healing Center.
So at the Discovery Health Healing Center, I take a little bit different approach than most medical providers out there. I try to work holistically, and I focus on something called restorative medicine. Okay. And if you simply break down the word restorative, I help people to restore their health. So no matter what level of illness or symptom or disease they're at, we can always find a common point or begin to identify the things in their life, from their stressors, from their foods, from their gut health, from things that have happened over their lifespan that are part of the reason that they have that symptom or that illness or that disease. So we start to, peel back the layers of the onion and take a holistic approach at the person, because not one thing in a person's body works alone. Everything works together. Yesterday, just as an example, 2 new patients who had come in, we had to talk about stress and the stressors that they've either been through or that they're still going through, and how much that's impacting their health. So it's a holistic approach to figure out what the causes of their issues are, and then we dive in and we start to change those things, knowing that all symptoms, all illness and disease start with deficiencies in the body and toxicities in the body. Those two things then lead to inflammation, and then inflammation shows as a headache, as arthritis, as belly pain, as constipation problems, or name any other common symptom that you or a family member or a friend complains about all the time. There's always something that we can do about it that isn't just, I have this symptom, here, take this medication. Sure. So we really try to get to the root causes. We have different modalities or different services here at the center that help to support the body's healing and repair process. But I also work with people all over the country through telehealth, through video conferencing to help them get on track to get their health headed in the right direction and to start to reverse disease or reverse the symptoms that they're having.
Mm-hmm. Wow. Well, thank you for that reintroduction, Dr. Kelly, and I appreciate that. And it really is a wonderful and different, too, how you take a holistic approach to things, versus westernized medicine, which we could always talk about, in later shows, because I'm really excited about learning about this IV nutrition therapy. I've never heard of something like this before, and for our listeners out there who have no idea about it anyway, I'm really excited that we're going to be taking up majority of the show to talk about this. So, and I assume this is also one of your specialties that you get to perform at your practice as well. So let's dive in. Let's talk a little about IV nutrition therapy, please.
Absolutely. So many people have had an IV before when they've been in the hospital or they've had a procedure done, and you're usually just getting some type of fluid during that so they can deliver a medication. But the basic principle that I want you to think about is, first, I said that all symptoms and illness and disease start with deficiencies and toxicities. And our best way to fuel our bodies is by eating good, healthy, organic food. Okay. But there's a problem. We don't always eat well. The sad American diet or the standard American diet is full of highly processed foods, tons of sugar, things like that aren't nourishing your body and aren't fueling your body. And then almost every single person that I meet who's looking to get their health improved has some level of a problem in their gut. And your gut is responsible for digesting your food and absorbing the nutrition. So in contrast to that, that's the basic principle. That's how we work. Mm-hmm. When I start an IV, a very small catheter into one of the veins in your arms, I can deliver much-needed nutrients right into the vein. It's 100% available to the body and 100% absorbable, and we get to bypass the gut. The gut is a defense mechanism. When you take vitamin C as an example, because vitamin C is so very important right now to keep our immune system strong, as well as some other ingredients, other nutrients like vitamin D and zinc and lysine to help combat infections and viruses. When you take it orally, one, you can only tolerate a certain amount before vitamin C will give you nausea or diarrhea. So your belly can only handle so much. Plus, when you take 1,000 milligrams of vitamin C orally, which is a good standard dose at one time, half of that is shunted right to your liver, and you never really get to use it. So when I deliver IV nutrition therapy, we get to bypass that gut, and it makes the ingredients 100% bioavailable for the body to begin to use. And so the IV nutrition therapy is customized to what that person needs. Mm-hmm. I can work on helping to just support their body, give them basic nutrients, give them amino acids, give them some vitamin C, give them things to help support their body the way they are in need. I definitely give a lot of vitamin C, and I have a high-dose vitamin C to help boost your immune system, to give you some energy, and to help keep your body strong. These IVs are great adjuncts to improving one's health. I'll give you another example that I often do with women.
Yeah.
Women have a chronic problem with being anemic or low in iron. And so when you go to your primary care provider, you'll get a synthetic form of iron, which is very constipating. It's hard to digest, and in an attempt to increase your iron storage. Iron gives us energy, and it helps to make our hemoglobin and hematocrit cells, our red blood cells. We can't live without it, but we tend to use it up. Women, of course, have 40 years of getting periods where we lose, blood, and we get very anemic. And so if our diet isn't good, we need iron foods, high iron foods, which can be in our vegetables and it's also in meats. But chronically, I find people who are chronically anemic, even though they take an oral supplement. Well, I can give a very safe form of iron, which is iron sucrose, through an IV to really actually replenish the body's iron stores so that we can get it up. The woman starts feeling good. Her brain starts working again. She starts to get a little bit of energy, and then things can start to come together as a whole in her body so that she starts feeling good and like the person she always used to be. But giving it through an IV lets us bypass the gut, lets us get her where she needs to be, so then her diet and her oral iron can now keep her at a good, stable level. But she often needs that direct boost to get there. Did that prompt any questions for you as I give you a little introduction into IV nutrition, Joey?
I was thinking, I would like to know, like, all the benefits that it certainly provides, and how often can this be done? If somebody is truly interested in it, can it be done daily, weekly, monthly? Is there a specific time frame?
So 100% depends on the person.
Okay.
Could you come in and get an IV nutrition bag on a daily basis? Absolutely, you could.
Okay.
The top priority is for it to be safe and to give your body what it needs. Now, depending how depleted that person is, how, run into the ground they're feeling, depending on what their symptoms are, I'll make a different recommendation for that person to follow. Let's take somebody who has a chronic illness, who is very, very chronically ill, like, fighting metastatic cancer or trying to keep themselves as healthy as possible while they're fighting with, some traditional ways, a different illness that's going on. That person may come 2 times or 3 times a week for a length of period of time. Now, that's one extreme example, and then I'll tell you I have several people who come in once a month. They come in to either get the IV called the Boost, which is very well-rounded with lots of vitamins and minerals and vitamin C and some amino acids, or they're coming in to get the Natural Defense, which is that higher dose of vitamin C to help boost their energy, to keep their immune system strong as an adjunct to stay healthy through the winter. So it all depends on the severity of illness and what that person is willing to commit to. A typical IV is going to take 1.5 hours to 2 hours.
Okay.
We let that volume drip in over that period of time, which allows the body to use it as it's coming in. You don't want that going in super fast because your body doesn't have time to deal with it as it's going in. When that IV drip is going in, your body is using it immediately, and we want it to have the best advantage and feel the best while it's absorbing those extra nutrients. So anywhere from a couple of times a week. Again, a person could come every day, but most people don't need that level of care.
Sure.
One thought just popped into my head that I get a question on is that people think that they get IV nutrition in the hospital, and they don't. You get fluid, and you may get hydration, but it's often lacking the customization of magnesium, potassium, calcium, zinc, or lysine, or vitamin C, or the amino acids. Those types of things are not traditionally done in the hospital.
It's usually like lactated ringers or something like that, right?
Right. So a lactated ringers is a generic bag that gives you hydration with a little bit of electrolytes, and that's fantastic. But absolutely, the different IVs that I do here are customized. And then also I've got some specialty ones that target your DNA, give your body a recharge and a way to recover and repair, and then start to move forward in a more healthy manner, because the better we get your cells functioning normally, which is our goal, the better that person is going to feel and the less symptoms they're going to have.
Wow. it's amazing because, like I never thought that something like this could be, in an IV. And do you feel it instantaneously, Dr. Kelly? Like, excuse me, as it's happening, do you feel it? Does it take a little while to, start feeling the effects?
So great question, and again, that's very person dependent. Sometimes people immediately tell me when their drip is done, like, "Ooh, I feel better already." There are a few occasions where that first day or that first iron treatment, the person in the evening is like, "Oh, I'm a little tired," because their body's working. Their body's working on that new nutrient that they just got. So many times it's building up how they feel, but also, I think about those people who come once a month for a maintenance IV, and they'll give me feedback that they feel fantastic for the next week or two. They know it's complementing their body. They feel more energy. Their brain is more clear, and they really can feel the benefit right away. Maybe not that day, but starting the next day and then for a couple weeks. So very person dependent. One person can feel it right away and then feel like it got used up and it was gone right away. And that tells us something about that person, that they're much more depleted than the person who feels like, yep, I only need a little bit of a boost once a month. It carries me through the month and I feel great.
Well, and that's excellent. Now, let me ask you. Obviously, we're all different, men and women. We're all different. But I was wondering, like, is there maybe? I think this is a fantastic treatment after hearing everything that you said about it, and I would encourage everybody to at least try it. But is there? Let's say, because as we know, our bodies change with age, and I was wondering, like, is there a certain age group or something along those lines that you would say, hey, you're at that age where maybe you should give this a shot, things are changing and maybe you should do this, maybe this will help you, other than other things that you've tried or are willing to try. Is that, optional?
Absolutely. A lot of people give the Discovery Health Healing Center a call because they've read something about IVs and they're wondering if they can come in and just try it out, and that's fantastic. I always do a brief consult to make sure it's going to be safe and figure out what they have going on to determine the best IV for them at that time. I'll tell you that it's not based on age, even though you said it exactly correctly that we change as we age. That's very true, but we don't have to have symptoms because we're a year older, or now I'm 80 instead of 60. I definitely concentrate on adults, but I would never say, ooh, you're 50 now, we better get in for IVs. I would say, what's going on? Where are you depleted? What kinds of symptoms are you having, no matter if you're 20 or 30 or 50 or 80? So to determine if you need IV nutrition to help you recover and repair is not age dependent, but it's what that person has going on, and if they would like to try something a little bit different to give their body a boost that isn't offered at most traditional places.
Okay.
Did that make sense?
It certainly does, and I love the way how you break everything down so we could understand it, And since we have a couple of more minutes left, I thought I would at least end the show with asking you this question, so at least our listeners out there know and have a better understanding. Now, obviously, there's a big difference between holistic medicine and westernized medicine. So I was wondering, for all those who believe so deeply in westernized medicine and maybe whatever issues that they're having might even be better to use those holistics and holistic medicine. So to those out there that may be better off trying holistics, what would you say to them to try to convince them in a way like, hey, listen, give this a shot. If it doesn't work, then at least we could say we tried, but I would try it for this kind of reason. What would you say to those who maybe are a little apprehensive about trying holistic medicine and trying to maybe coax them into giving it a shot because it very well may work for them?
Well, I'll tell you that I never try to convince someone.
Okay.
Because all of the services that I have available are here for the people who want to give it a try. I don't want to try to convince them to do something that doesn't feel right to them, but I do want to empower them, and I do want to increase their knowledge. So what often happens is I have one person coming in who wants their spouse or wants their mother or wants their daughter or somebody else coming in to do it too. Mm-hmm. And what I even encourage them to do is plant some seeds versus, you need to do this, this is so much better, or this is different. The person has to find value. I'll tell you that most people who have done traditional medicine, when they come to the point that they don't like the side effects from their medications, or they're not getting the results that they're looking for, or even a woman yesterday who said, I brought all of my symptoms to my doctor, I wrote them all out so we could talk with him, and he never even looked at it. And she was so disappointed because these issues are real for her, and they are impacting her quality of life. So that was the push that gave her the idea, maybe I need to look for somebody who does it a little bit differently. And then, so yesterday was our first conversation, and during that conversation, I listened, and we identified her top concerns, and we made a starting point to help her change the symptoms that she was suffering with. But also, at that time of that first consultation, it gives that person the opportunity to hear how I work, what I would suggest, what we would do differently, how we can improve their health. But they always have the option to say, okay, I explored that, I just don't think that's right for me. And I am always okay with that, because if you push something on someone and it doesn't feel right to them, they'll never do well.
Sure.
So most people come when they've had failures in the system, or they don't like how something went, or they'd like to try to approach it a little differently. That's exactly what I'm here for, and we'll meet them where they're at to help them progress differently. And then we can also work on getting healthier, which then leads to the opportunity that their primary care doctor is able to decrease medications because they don't have the same need anymore because we've changed things in their body. So again, I'm very cautious about trying to convince someone because I don't believe that ever really works.
Okay.
But I do want to give out information, and then when something connects with them, to encourage them to explore more, and then we talk about it, and if that seems like a good idea or a good place to try, then we'll start to work on that, and I'll gradually increase their education over time so that they can be empowered to do what they feel is right for their health, and then guide them through that to be doing the right things.
Absolutely. And I think that says a lot about your personality as a doctor, too. You know, saying, hey, you know what? Maybe it will work. Maybe it won't work. But, you know, you'll never know until you at least give it a shot. And you know what? Quite on the contrary, Doc, I'm sure it could happen where you have been in this situation before. And now people come to you and go, wow, this was life-changing. This I don't even really need to do, westernized medicine or with what my specific issue I have going on. This was the best decision I've ever made. So I'm sure it can go both ways.
You bet. Absolutely.
Well, in that case, I hope that everything continues to go up and up with holistic medicine. And I want to thank you again, Dr. Kelly, for a wonderful show. Next week, everybody, we might dive a little into, helping us stay healthy or reversing diseases. That is what they're all about over there at Discovery Health Healing Center. So as we conclude our broadcast, another great show from Green Bay, Wisconsin, everybody. That is where her practice is located. Get in touch with Dr. Kelly Felmer today. Start living better. Start feeling better right now. There's nothing better than that. So please, Doc, tell us how we can get in touch with you for more info.
I would encourage you to check out the website at dhhealingcenter.com. You're going to find a wealth of knowledge there. It describes all of the different services that we do, from the consultations that I personally do to the most common IV nutrients that we do to our photobiomodulation. And it really gives a description of how we work here at the Discovery Healing Center.
Sure.
And if that's something that resonates with you, you'd like to explore more, you can just give us a call at 920-343-6443. But please check out the website because a lot of your questions will be answered right there, dhhealingcenter.com.
Thank you so much. And again, everybody, that is dhhealingcenter.com, again, for Discovery Health. So dhhealingcenter.com. Check out the website today. Everything you'll want to know about her practice will be there. And I encourage you all to reach out to Dr. Kelly Felmer. Dr. Kelly, thank you so much for a great show. I'm looking forward to a great one next week as well. And to everybody, tune in with us 11:30 a.m. Eastern Time, where we will be hosting Dr. Kelly once again. Thank you so much.
Thank you. Have a great day.